Hola, buenos días, buenas tardes a todas y todos. Bienvenidos a la rueda de prensa de la Organización Panamericana de la
Good
Salud.
morning, good afternoon to all of you. Welcome to this press briefing organized by PAHO today. That is September 7th, 2022. I am advisor on public affairs here with PAHO. As usual, we have interpretation into English, Spanish, French, and Portuguese, and you can find your options under interpretation. We have already received your questions via email. We thank you for the questions that sent us the questions ahead of time, but of course you can ask your questions during the session by using the Q&A button. We are going to start our session with the remarks by Dr. Carissa Etienne, who will be sharing with you an update on the current COVID-19 situation, as well as the monkeypox in the region. And together with Dr. Etienne today, we have Dr. Marcos Espinal, who is the Interim Assistant Director, Ciro Ugarte, who is Health Emergencies Director, and Dr. Jaime Rico, who is an advisor on viral emerging diseases. I give the floor to the director.
Thank you.
Thank you very much and good morning. And let me welcome you back after a month's break. Thank you for joining today's press briefing on COVID-19 and monkeypox transmission in our region. Over the last several weeks, COVID-19 cases, hospitalizations, and deaths have decreased across the Americas. Despite these trends, however, hundreds of people are still dying every day from COVID-19 across our region. Just last week, we had 4,954 reported deaths in the Americas. Compared to other diseases, COVID-19 is still a significant threat to our population and to our health systems. We must not and cannot be complacent because this virus is still circulating, still evolving, and new variants can still emerge. We are concerned because some countries have significantly scaled back their public health measures while millions remain unvaccinated. Member states must make every effort to reach their zero-dose populations. Today, most of the vaccines delivered in the Americas are boosters for people who have already been immunized. This is important, but 10 countries and territories in our region have yet to fully vaccinate even 40% of their populations. And across every country in our region, there are still groups that have not received even a single COVID-19 vaccine dose. Unvaccinated people will be the most affected when the next wave of cases comes. And that's why we must prioritize reaching those who remain unprotected. And this includes our kids, many of whom are going back to school this month. Indeed, parents should be encouraged to get their children up to date on all their shots, including any vaccines that they may have missed over the last few years. Now I want to focus on monkeypox, since the Americas have once again become the epicenter of a global disease outbreak. Monkeypox was declared a public health emergency of international concern in July by the WHO. And our region is now home to the highest burden of monkeypox cases worldwide. As of September 6th, over 30,000 monkeypox cases have been reported in the Americas, with most cases concentrated in the United States of America, Brazil, Peru, and Canada. Thus far, most confirmed cases are among men who have sex with men, although at least 145 cases have been reported in women and 54 cases among people under the age of 18. So far, 4 monkeypox-related deaths have been reported in Brazil, Cuba, and Ecuador. During an August special session of the PAHO Directing Council, member states requested support in obtaining access to the monkeypox vaccine. Since then, PAHO's revolving fund for vaccines secured doses with Bavarian Nordic, making ours the first WHO region to make monkeypox vaccines available to member states. But doses remain limited. So PAHO has issued recommendations to member states to prioritize available doses for high-risk groups. With vaccines in short supply and with no effective treatment for monkeypox, countries should intensify efforts to prevent the spread of the virus in our region. And we have the means to slow down this virus. First and most critically is effective communication. In too many countries across our region, LGBTQ+ communities face stigma and discrimination that impacts their health and well-being. Stigma has no place in public health. It prevents those at risk from accessing information, getting tested, or seeking medical attention when they show symptoms. If we aren't proactive in overcoming these barriers, monkeypox will spread in silence. Countries should leverage their HIV/AIDS experience and establish active awareness campaigns using pragmatic, honest, targeted messages so that everyone knows how monkeypox is spread, how to identify specific symptoms, and when to seek medical attention. PAHO has been working actively with civil society and the LGBTQ+ communities across the region to raise awareness about monkeypox symptoms and to provide information about preventive measures. We have also published guidance for health authorities on how to communicate with at-risk groups, and we've had several workshops to support country efforts to engage affected communities. Beyond communication, surveillance and testing are our best allies against monkeypox. If we don't know who's infected or who is at risk of being infected, we don't know where to focus our efforts. Countries should therefore increase and decentralize their capacity for testing, specifically for high-risk populations. And our health workers and community outreach workers must be trained to identify symptoms and to provide their patients with correct information, as well as high-quality, respectful care. PAHO has held trainings and provided resources to at least 37 countries and territories in our region to do just that. And we are working to ensure that all countries in our region have enough supplies and updated guidance to maintain monkeypox testing. As we saw with the global COVID-19 response, access to resources and sustained collaboration are key to stopping a virus. We should not waste time in applying this lesson to monkeypox, or we risk allowing this outbreak to worsen. We must work to break down stigma and discrimination, or our most at-risk populations will not seek care. And we must make all efforts possible to ensure that the limited supplies of vaccines and other essential tools reach the populations at the highest risk first. Whether we are talking about COVID, monkeypox, or other threats, an effective public health response requires us to be decisive, to act fast and prioritize support for the most vulnerable in our region. And that is how we will get through this together. Thank you.
Thank you very much, Director. We'll stay with you with the follow-up questions that we received from a lot of media. Can you give us more details about PAHO's efforts to secure the monkeypox vaccines? When will these vaccines be available to countries? Dr. Tien, please.
Thank you for this question. Following the request from our member states in early August, PAHO has secured an agreement with Bavaria Nordic to provide 100,000 doses of the monkeypox vaccines to countries in Latin America and the Caribbean through the revolving fund. Our efforts will permit countries in this region to access the vaccine even in small quantities, which would not have been possible otherwise. Member states were asked to place an order for monkeypox vaccines, and we received requests from 12 countries. It is important to note that in this constrained supply scenario, that we need to guarantee equitable allocation. And this requires the prioritizing of vaccine distribution to maximize the health impact. So partial deliveries to countries that requested vaccines will start now in September. We are receiving the final logistical details, such as estimates for freight and insurance. And the deliveries will be prioritized based on the epidemiological situation in countries. So let us just remind you that the vaccine will only complement the monkeypox response in the region. The other measures, such as the engagement with at-risk communities, surveillance, testing, and contact tracing, remain crucial. Vaccination, when available, can be deployed as a preventive measure to persons who may have been exposed, such as household members and health workers. And let's note that PAHO and WHO is not recommending mass vaccination at this time. But let me assure you that PAHO is continuing to follow the monkeypox outbreak and to work with countries to ensure that we can contain this outbreak and give the best advice to our member states. Thank you.
Thank you very much, Dr. Tien. Seguimos con preguntas sobre la viruela símica. Empezamos
We
con
continue questions on monkeypox. We start with a question from our colleague Elena Paucar from Diario El Comercio, Guayaquil, Ecuador. She has two questions. I'll try to sum up the first one. Based on the genetic studies in the region, what is the variant of the monkeypox disease that is circulating? What is the type of genomic monitoring that is recommended to the countries in the Americas to observe mutations? What is the likelihood of mutations, and taking into account the uptake in the number of cases? And Elena is also asking how much diagnosis is being carried out in the region, how well supplied are the labs for the PCR testing, and also whether there are any guidelines offered by PAHO for sampling. Dr. Mendez Rico, please. Thank you very much for such important questions. There are several, and I'll try to sum them up. The monkeypox has been classified under two different lineages. We have the first one, clade 1 in Africa, and clade 2, clade 2A and B. So all of the viruses identified so far have been globally identified. Those, and that includes the ones in the Americas, they correspond to clade 2B. Of course, we already have genomic monitoring for all of the groups. We have new information on a daily basis, and we include sequencing in our region, which is very important for follow-up. On the other hand, and as we already mentioned here in the past, the mutations are frequent among viruses as part of a process that is normal in the evolution and adaptation. However, viruses such as monkeypox that include DNA and genetic material, the mutation usually is slower if compared to other viruses such as COVID that has a rapid evolution system. To that end, in some countries that have high transmission, we start to see processes of what we call micro reduction. There is a diversity of the viruses, so there could be subclades or sublineages. So far, we have not seen any changes that imply higher transmission, but it is important to maintain surveillance, in particular to anticipate any mutation of interest or any impact on public health. Now, as to the diagnostic capability in the Americas, as of mid-May, the first guidelines and lab recommendations recommendations were issued indicating prioritization for sampling and clearly including all of the security conditions. And 3 trainings in person were offered in Brazil through BioCruz, in Jamaica, and at the Ingrid in Mexico for the Central American region. We also had parallel training sessions, and we also distributed the material for the PCR detection of the virus. As Dr. Etienne just mentioned in her prior intervention, at the present moment, there are 37 countries and territories that already have installed operational capacity for the identification of monkeypox, and we're working closely with the countries to decentralize the diagnostic capabilities gradually based on the epidemiological situation. I hope I have addressed all the questions. Thank you very much. I thank you, Dr. Mendez Rico. We move on to a question by Daniel Colin from TN23 Guatemala. What are the actions to be strengthened by Guatemala after reporting 11 cases of monkeypox? Is there a risk of community transmission? Dr. Ugarte, thank you, Luciana, and thank you, Daniel, for that question. We should recall that as to how the monkeypox is transmitted. Individuals that have symptoms may transmit the virus by close contact by other individuals. Any type of skin openings, body fluids, and also any lesions or scars are especially infectious. So the most common way of transmission had to do with sexual encounters, but also individuals who closely interact with someone who is infected. For example, health workers or family members, they also have a relative higher risk of infection. We should recall that individuals that have monkeypox remain infectious and until they have symptoms, and that could be between 2 and 4 weeks. So individuals who have symptoms should remain isolated for that period. And contacts for individuals with monkeypox should be daily monitored. There shouldn't be any restriction, but close monitoring at least for 2 or 3 weeks, and that is the recommendation. So given those conditions, it is necessary to strengthen the communication and the commitment of the risk community, of the communities at risk, as Dr. Etienne mentioned. This is highly important, first to facilitate detection of cases, but also to reduce transmission and also prevent others from acquiring the disease. We should also implement detection and timely treatment of individuals. Clinical diagnosis and also lab diagnosis are very important because that could also protect the individuals who are in close contact, but that could also reduce transmission at the level of individuals at higher risk. Lab confirmation and also an increase in epidemiological analysis could help us decrease the number of cases in Guatemala and in other countries, as we have seen in other regions such as Europe, etc. So it is important for all of us to be aware and for the health authorities to implement the measures that they started to implement to reduce the transmission chain and also to finally control monkeypox. I thank you. Luciana, thank you, Dr. Ugarte. We have questions by Mexican journalists on the monkeypox situation in the country. As Insulza from Bloomberg and Andrea Veraz from the Formula Group from Mexico, who are asking, with more than 700 cases of monkeypox in Mexico, the government should strengthen some of the measures to control the disease, correct? Dr. Ugarte? I thank you, Luciana. I should underscore the final comments of my previous remarks. We need to be in close contact with the individuals who have high risk, who are at high risk of transmission, and involve them in the prevention and early diagnosis efforts, alert and reporting, and as well as care. This has to do with risk communication. This is extremely important and effective. Next, we should also implement as soon as possible detection of cases. Dr. Jairo Mendez Rico informed that the labs in most countries, in Mexico and in many other countries, do have detection capabilities. So it is possible to detect cases in time. And once cases are detected, we should immediately look for contacts. And when looking for contacts, also implement the monitoring of the contacts and also the isolation of confirmed cases. With that, we interrupt the transmission chain, but at the same time, we reduce the probability for this to spread to more individuals beyond that immediate area that is also limited among those who are at higher risk. But there are some cases that we see in individuals that do not have sex with other men having sex with other men, and that is the greatest concern and the most important aspect to take into account. Thank you very much. Thank you, Dr. Ugarte. We move on to a question from Nicaragua. Gabriela Solorzano from Channel 12 is asking whether Nicaragua has not sent any notification on monkeypox or suspected cases, and also what do we know of the situation in Nicaragua regarding this topic? Dr. Mendez Rico, please. Thank you, Gabriela, for your question. Well, currently we do not have any official reporting on monkeypox in Nicaragua. As we have seen in several countries in the Americas, the emergence of new cases has been sporadic and gradual, and we see more cases being detected, and it is important to highlight that it is necessary to have active surveillance based on currently used systems such as the ones used for HIV to facilitate the identification of new cases. In Venezuela, there has been strong work with the government so as to determine the first cases of monkeypox, and clearly we will continue to see other cases. Nicaragua has robust surveillance together with the other countries in the region. They have participated in training workshop for detection through lab methods, so they have all of the installed capacity and the means to identify the virus so as to timely implement control and contention measures for the disease. I think that I have addressed the question. Thank you. Thank you. Gabriela has another question regarding the vaccines. She's asking whether PAHO, by means of the mechanisms, will be facilitating the vaccine to countries such as Nicaragua, and whether we have any expectation to send vaccines to Nicaragua. Dr. Espinal, thank you, Gabriela, for your question. As Madam Director indicated, PAHO has facilitated access to these vaccines, and the first one should be arriving in September. However, the countries were asked whether they were going to order the vaccines. You would recall that the vaccines need to be purchased. The vaccines are limited, as the director mentioned, so each country had their own answer, and as the director indicated, 12 countries have already committed and signed to buying the vaccines by means of the revolving fund. There are other 7 countries that are having discussions and have the possibility to order vaccines. Nicaragua has not ordered the vaccines at the outset. They showed some interest, but they do need to make a final decision as to whether the vaccines will be ordered or not. As Jairo mentioned, Nicaragua has not had any report of monkeypox cases, and we should also clarify that, as Dr. Ugarte mentioned, Jairo, and the director also mentioned, the vaccine is a tool to help, but it will not be solving the final problem. We need proper surveillance, isolation of contacts upon identification, because As seen, they are already saying that this will be decreasing in Europe, so it is necessary for education, the work with the LGBTQ+ community to be done strongly, and diagnosis. The vaccine helps protect some of the contacts. It is not recommended to implement a mass vaccination campaign. Therefore, some countries may decide not to request the vaccine or not to have access to the vaccines. So the countries that have requested the vaccines will be receiving the vaccines as part of the first batch in September. Thank you. I thank you, Dr. Espinal. And now we have a final question regarding monkeypox from our Caribbean colleagues.
News in the Bahamas. Tyler asks 2 questions on monkeypox. The first, the Bahamas has so far confirmed 2 positive cases. According to health officials, both cases were isolated. Can you give any advice on what the Bahamas should do as a small island nation in the event of an outbreak of monkeypox? Dr. Ugarte, please. The first question.
Thank you, Luciana. Thank you, Tyler. As the Bahamas, as many other countries in the Caribbean, have been implementing measures since the beginning to detect and prevent the transmission of monkeypox. And one of the characteristics is the laboratory capacity, and that's why the Bahamas was able to identify those cases, and both cases, as you said, have been isolated. So that's a very good measure. Some other aspects, some other topics that must be implemented is to alert and protect healthcare workers. They must be alert to identify those cases that may come with few symptoms, but a proper interview may identify a contact, close contact with somebody who may have monkeypox. And also, of course, the communication and engagement with populations at risk, as we already said, to enable both the rapid detection, but also reporting of cases, isolation, and monitoring of contacts. Strengthening epidemiological surveillance is paramount on this. We will find more cases if we look for them. Well, let's not have the cases come to us. We need to look for them and find them in the community, in the places where we can do that, so we can control this outbreak. Thank you.
Thank you very much, Dr. Ugarte. Tyler has a follow-up question on monkeypox vaccines, if we can say when the Bahamas will receive them. Dr. Espinal, I don't know if we have anything to add on this.
Just short answer. Thank you, Tyler. Yeah, as I said, we will expect the countries that has committed to purchase the vaccines through PAHO revolving fund are expected to receive part of the vaccines in September, where we expect to have the first batch from Bavarian Nordic. There will be a second batch in November, and the third, another one in December. So Bahamas, I can confirm, requested the vaccines and has signed off all the documents. Thank you.
Thank you very much, Dr. Espinal. A final question from Tyler, now turning to the topic of COVID-19. Tyler asks, Bahamas officials have said once the country reaches 70% vaccination rate, the mask mandate will be lifted. Is this recommended? And when should the Bahamas decide to lift its mask mandate? Dr. Ugarte, please.
Thank you for that question as well. Regarding COVID-19, many countries have adopted the risk assessment approach. And each of the countries are using several factors to decide when to lift, for example, the mask mandate in this case. And vaccination level is one of the aspects, but must be also along other types of other signs or other topics like the transmission level, for example, the hospitalization, the number of deaths, and also how the population is performing in terms of reducing the risk of getting COVID-19. So the tests, for example, implementing tests and analyzing those tests and doing the genomic surveillance and several other aspects are part of this process. So when we lift the mask mandate or any public health measure to reduce that reduces the transmission, we will see an increase of cases. So the health services must be also alert to do that, and the communities and the population must be also properly informed so they can reach the health services as soon as possible. Thank you.
Thank you very much, Dr. Ugarte. Quedamos con el tema de COVID-19. La próxima pregunta es de Nidia Ruiz.
Next question is from Nidia Ruiz de Pacho 505, Nicaragua. She wants a comment about the declaration of the vice president who said that they're happy with the publication made by PAHO, recognizing Nicaragua as the first country in Central America and the fifth in the Americas with full coverage, of full schedule of vaccination against COVID. So her question is, how was Nicaragua able to go to this place even though a few months ago they were behind in this process? What figures does Nicaragua have? Thank you very much for your question. I'm sorry I was muted, but here I am. It's never too late to get started. It is true that Nicaragua was lagging behind, but they made an excellent effort, supported by our country office, who has supported Nicaragua not only in accessing the vaccines, but also improving the cold chain and ensuring that they will receive vaccines not only through COVAX, but also through the revolving fund. And so that's why Nicaragua has an 80% coverage and 85% for full schedule, and they continue to work with our office to ensure access to the whole Nicaraguan population. So they've done a great job. They also benefited from support from friendly countries. And that's the idea, that our countries will eventually vaccinate their whole populations. Thank you. Thank you, Dr. Espinal. Now a question from Matias Levy from Argentina about the boosters. Matias wants to know, Canada and the US have approved their latest updated vaccines or boosters adapted to Omicron variants. So how necessary and urgent is it that Latin America continues or follows in their footsteps? What do you recommend, Dr. Espinal? All vaccines are important, but the most important thing is to ensure that coverage continues. We have many countries in the region with less than 40% coverage. So new boosters, new vaccines do nothing if we are not educating the population so that they get vaccinated. Yes, there are new variants, and yes, countries make their own decisions given that they are sovereign, and what we can say is that this is not the last vaccine we'll see. There are others in the pipeline to be approved. What may happen with COVID is that we will see it every year with a behavior similar to influenza. We have not left the pandemic behind. We still see cases in our countries. We see mortality still. So the most important thing is not to buy a new vaccine, but make sure that those vaccines we have are used to increase the immunity and vaccine coverage in all our countries. Thank you. Thank you, Dr. Espinal. We have two questions about another topic, the pneumonia outbreak associated to Legionella in Argentina. So first question is Pajo's intervention in a hospital in Tucumán regarding the outbreak of Legionella. And the other question is, how do you take samples for Legionella infections? And where are they going to be analyzed, and how long does the testing take? Thank you very much. We, as PAHO, do not do interventions on outbreaks, but we support countries, and we are supporting the province of Tucumán to help characterize whatever is going on at this point in time. Argentina has its own capacity to detect Legionella, uh, and and they have the support of the Malbran Institute to do the testing. Characterization of Legionella is done using different lab techniques, including molecular testing based on genetic material such as PCR, as well as other bacteriological tests based on cultures, etc. So, investigation about water sources, showers, tap water, etc. Some tests results are within 2 weeks, but others may take over a week. Excuse me, some can take about 2 days, others over a week. Of course, we will be continuing to report whenever we have more information available about these Legionella infections. Thank you, Dr. Mendez Rico. We have a question from Juan Manuel Nieves from Agencia de Noticias Chihuahua. Several questions related to the Tucumán outbreak. So where does Legionella come from? Why is there an outbreak? Is there a relationship between pneumonia and COVID-19? In particular, if both affect a patient at the same time, what consequences if the patient is both infected with Legionella and COVID? Why is the death rate so high? And can you say something about cases, numbers of cases, and deaths? Dr. Espinal, oh, thank you for your many questions, which are important questions, I should add. Legionella was detected for the first time in the city of Pomblac in Michigan in the United States in the year 1968 as a disease. And it was called Pontiac disease because it was first detected in Pontiac. But in 1976, during a convention of the American Legion in Philadelphia, uh, there was an outbreak, and that's why it's called legionellosis, and then the name of Legionella haemophila, which is a bacteria. It's different. Two viruses. And, and, and you know, we have SARS-CoV-2 is a virus which causes COVID. So but Legionella is a bacteria. It causes frequent outbreaks, but it is not a virus. It's very different. It's a bacteria that lives naturally in soils, in the ground, and also in water bodies. For example, if you have air conditioning systems which have circulating water, and there's always water uh, leaking through air conditioning system, and these uh, may become infected and create outbreaks in hospitals. So, why are there large outbreaks? For example, in hospitals, we have usually elderly people, people who have comorbidities, and also people who smoke. However, it is a curable disease. There are antibiotics. The macrolides are used to treat Legionella, and it is an outbreak that can be perfectly controlled. As Dr. Jairo Mendez said, the country office in Argentina is supporting authorities in their response, and tests, evaluations are being carried out, other assessments about their the hospital internal system, so that they make sure that their HVAC systems are clean, and they are make sure that there's no infection anymore. But again, to emphasize, it's not related at all with COVID-19 infection. I hope I answer your question. Thank you, Dr. Espinal. Dr. Mendez Rico, do you want to add anything else? No, no. No, I totally agree with what Dr. Espinal has just said. And exactly that's what we're working on through the country office of Argentina, supporting the Ministry of Health as well as the province of Tucumán in Argentina. And now a follow-up question on monkeypox from Coronadeño in Costa Rica. Should countries implement special controls with tourists that are visiting regarding monkeypox? Dr. Ugarte, please, over to you. Thank you, Luciana, and thank you, Luis, for your very important question. Many countries have their main revenue coming through tourism. And with monkeypox, I mean, many are saying, well, no, let's stop monkeypox from entering, so we need to control tourism. The fact of the matter is that visitors and tourists and nationals of a country coming back from another country should have enough information so that when they have symptoms, they know where to go, what number to call, where to receive necessary orientation in case they find a person who may have symptoms, and also to access laboratories, because in Costa Rica and in many other countries there is the capacity to detect monkeypox. So this is the main recommendation, to provide information in the community, which includes tourists and visitors. They should all receive information. There should be no restriction whatsoever regarding traveling. And these are the recommendations that the Emergency Committee of the International Health Regulations of WHO have recommended and ratified by the Director General. There is follow-up question, but I see that Romero Antonio Guerra Palma asked, what is the relationship of the what is there a relationship between smallpox and monkeypox? Smallpox having been eradicated. In this great family of pox viruses, we have different genuses, and in the virus, we have many, including smallpox, which is the one that led to a great deal of disease and death up until it was eradicated in the 1970s and 1980s. But the monkeypox is in the same genus. These are very different viruses. Their origins are different. However, they produce a similar disease. Nevertheless, the disease due to monkeypox may be milder than what we had for smallpox. In this case, however, there are some proteins that they share, so there's a certain level of cross protection. And people who received smallpox vaccine may have up to 80% protection, cross protection with monkeypox. However, studies are being done in this regard to see what the situation is at present. However, these are different viruses, but they generate similar disease. I hope I have answered your question. Thank you, Dr. Mendez Rico. And thank you to all the journalists. We have come to the end of our press briefing today. Thank you very much for your participation. And we will have a press briefing in 2 weeks, but we will be sending you notifications about this. We are at your disposal for any further questions. You can send us a message to media team at paho.org. You can also find more information on our webpage, www.paho.org. If you have questions about COVID numbers, about monkeypox numbers, our dashboards have a great deal of information, so visit our website. Thank you for being with us today, and we'll see you in 2 weeks.